Hello, good afternoon. We are discussing GERD or gastroesophageal reflux disease today. It's a very common problem. Almost 20% of the people, adult people, are suffering from this disease or this condition in the United States of America. And if we consider it for our country, India, it's around 10% of the population who are suffering from. But mostly majority of the patients suffering from GERD is having a very mild disease. They don't even also consult their doctors often. But there are possibilities of complications and with severe dreaded complications also. And first of all, we should think what is GERD or gastroesophageal reflux disease. This is nothing but reflux of the gastric content into the upper food canal, which is known as esophagus. And we all know that our gastrointestinal system is a one-way pathway. We are taking food through our mouth, going down through the food canal to stomach and gradually down and down through intestine, small and large intestine, but it never comes up, should not come up. It's a one-way journey. But in gastroesophageal reflux disease, this gastric content may sometimes can come up into the esophagus, and that's causing the problem, and that is known as gastroesophageal reflux disease. And how can it develop? So first of all, if we think is the food canal, that esophagus should make it down, food should go down through the canal. So there can be some problem in the esophagus itself. This going down food through esophagus is by way of peristalsis, going down. But if that peristalsis is defective in some cases, in some rare diseases, but commonly there may be problem with the lower esophageal sphincter, or LES, shortly known as LES, lower esophageal sphincter. Commonly that pressure is 10 to 30 millimeter of mercury. So if that pressure is very lower than 10, then this esophageal sphincter is called lax, very lax. So gastric content may come up. Normally it should not come up, as because this esophageal sphincter, lower esophageal sphincter, is tight enough not to allow any food content from the stomach to upward. And this sphincter is in a abdominal position, so it has got its external pressure also from the diaphragmatic crura or muscles. So that is the normal mechanism not to allow reflux. But sometimes it can happen. This very commonly, almost 70% of the reflux occurs when it is just an transitional or just a momentary or very for a short time. Say for example during swallowing of food. So esophageal sphincter must be lax at that time. And from that point of view, if there is intra-abdominal pressure goes up, like fatty abdomen, or there is excessive amount of food, taking food in one time, or there may be pregnancy, that causes an increase in intra-abdominal pressure, or even in some diseases there may be fluid in the abdomen, which may also cause increase in the pressure. So if there is increase in the intra-abdominal pressure, then lower esophageal sphincter may be a lax one. So that causes the acid reflux. So these are the two things, defective in peristalsis and lax lower esophageal sphincter, that is in the esophagus. Then the stomach itself may be at fault. This gastric emptying may be delayed. So that due to different disease, and diabetes is one of them, very common disease, which can sometimes may cause delayed emptying of the stomach itself. So that is another cause, and there may be other reasons also. Associated conditions like hiatal hernia. Hiatal hernia is nothing but, and through a small aperture in the diaphragm itself, part of the upper part of the stomach goes in the chest. So that causes a pouch, formation of the pouch. Then that gastric content may be entering or may be staying there in the lower part of the esophagus for a longer time, giving rise to injury to the lower part of the esophagus. That causes reflux symptoms. So that may be another cause, and some types of foods and medicines that can also cause gastroesophageal reflux. So there are these sort of few causes which can give rise to esophageal reflux, and I think this is due to the obesity has become a public health problem these days, not only in developed countries but also country like ours. We are having this public health problem like obesity. So that causes intra-abdominal pressure that may give rise to GERD, GERD, or different type of food, taking excessive amount of fatty food that floats in the stomach up, or there may be other foods like giving rise to excess acidity like tomato, like onion. There may be other citrus fruits, etc., which can give rise to excessive amount of acid. So that may give rise to reflux. So these are the things which can give rise to reflux. And what will be the symptom? How do you know somebody is having gastroesophageal reflux? Usually we do not need any batteries of investigation for this disease. If the disease is uncomplicated and simple one, this pure symptoms of the patient is enough to start treatment. And what are the common symptoms? Are heartburn. This is a burning sensation in the chest area, burning sensation, and even giving rise to burning in the throat also. That sensation usually starts 30 to 60 minutes after a full meal. So that is the commonest symptom, heartburn. After food, usually patient complains, and very many patients, almost 30% of the people may complain these symptoms 30 to 60 minutes after a food, having a heartburn. That is a temporary reflux in a common population. But daily complaint may be there in adult persons or population around, say for instance, about 10%. So this is the commonest symptom. And what will be the next symptom? Regurgitation. This sour gastric content may come up in the mouth, fluid, or even parts of the food also, solid food also, that can come up. That is the regurgitation. If the patient having this heartburn and symptoms of regurgitation, we can take it sure that the patient is suffering from gastroesophageal reflux, and you can start treatment without going through excessive investigation. And other symptoms may be going down for, if the GERD symptoms are persistent for a longer time, patient can have dysphagia, that is difficulty in swallowing down food. That can be due to the problem in the lower end of the esophagus. We call it peptic esophagitis or reflux esophagitis. That may give rise to dysphagia, or even painful swallowing also. That may be due to formation of the stricture in the lower end of the esophagus. That is a complication of GERD. So we do have medicines in our armamentarium. Commonly, proton pump inhibitors is the mainstay of the treatment for this gastroesophageal reflux, and sometimes we may need some prokinetic agents, so the other drugs. But even if patient is having long medical treatment, but he or she is not improving, or otherwise patient doesn't want to have a long medicine treatment, in those cases we may sometimes need a surgical treatment for GERD. So in a nutshell, without complication, the simple uncomplicated GERD is like this. The reason I have, what are the causes I have told you, the common symptoms I have told you, and treatment, there is medical treatment. If medical treatment is prolonged one, or if medical treatment is not giving rise to full relief to the patient, or patient doesn't want long treatment, in those cases we may need a surgical treatment. And for complication, usually we do not want to jam your head with complications also. There may be some dreaded complications also. As one complication I have already told you, regarding this stricture in the lower end of the esophagus, that may be a complication. And Barrett's epithelium, Barrett's esophagus, another complication, they change the lining pattern of the lower end of the esophagus, and some of the cases, though very few, may develop carcinoma or cancer at the lower end of the esophagus or a long-standing GERD. Thank you.